Hello, my name is Cora Okkema, and I'm a dairy educator with Michigan State University Extension. Today, I'm going to be showing you how to do a general cattle health exam. To orient yourself to the cow, and when we talk about left and right side, if the cow is facing with her head towards you, this is going to be her left side, and this is going to be her right side. If you are looking at the cow, it's going to flip. So when I am either bringing the cow in the chute or just moving her up, I am always looking over her body condition, but also once I have her in here, I just do a general look over. So looking at overall fill, condition, picking up any clues early on if there's something that I should be concerned about. I'm also looking at her coat and her hair to see if it is rough or if it's nice and shiny and smooth, um, or if there are any signs that say if she was close to having a heat, that maybe she had hair rubbed off from a standing heat or anything like that. So I'm constantly looking, constantly examining, trying to see if there's anything out of the ordinary that I can just pick up visually before I start my physical examination of her. Before we begin the health exam, I like to get a bucket of all of my tools that I'm going to need prepped and ready to go. That's going to be chute side if I need to grab anything. So to start, we're going to have a stethoscope, and that can be used to listen to the heart, to lung sounds, to rumen sounds, and to check if we have a DA. Next, we have some breeder sleeves or some long arm sleeves to cover our arm when we need to check manure. And then we have our latex gloves that we want to put on anytime that we're handling any animal fluids such as blood or anything like that, just to protect us from zoonotic diseases and any transmissible bacteria, stuff like that. And then towels if I need to wipe anything down either before I sleeve her or to check for any discharge if she's a fresh cow, or we're checking for any of those reproductive issues. And then also ketone strips, and that's to check for ketosis in cows through urine analysis. And then we also, if we're unable to collect urine, we also do have a blood sample kit to check for ketones. And then last but not least, we have our thermometer here, which is going to be the very first step that we do whenever we check a cow. Another big piece of working with cattle is going to be human and animal safety. So whenever I get behind a cow, I try my best to let her know that I am doing that and that she can see me and that I am visible and that I am always aware of her movements so that I don't get kicked, or if I see that she is trying to kick me, that I can move myself out of the way. The same goes for when you're up at the front towards the head. Always kind of keep an eye on her, see what her head movements are doing so that she doesn't bonk you in the head, or that you cause her to get very flighty. So right here, I have just a glass thermometer that is within the range of 96 degrees up into 110 degrees. And we use this as a way to check rectal temps. Just be very careful because this is a glass thermometer and there is a specific way to know how to read this. With these, whether it's habit or not, I just always shake it. And then I grab her tail so that she knows that I'm here, and then insert, and then I always make sure to try and press it up against the internal wall, and that's to ensure I get an accurate read. But also you have to be careful because this is a glass thermometer. They are prone to breaking if you use too much pressure. And so I just let that sit in there. And while that sits, I'm also looking over her her rear side and look to see if there's any obvious injuries, any scabs or raw spots. This girl, she is a fresh cow, which means she's recently calved. And so another thing that I'm looking at is any discharge sitting on her vulva. And let's see if we can get a reading. Clear that. So right now she's actually sitting a little high at 103, it looks like. And so I'm going to just do a second check. An average temperature range for a cow is between 1013 and 1025. Anything above that technically indicates a fever. And if you want to treat for a fever, consult your veterinarian on the treatment protocol for that. Let's see, we'll do a recheck. Yep, once again, she's sitting at that 103 point. Right. So the next thing I'm going to check is for discharge. And you can see here that she actually does have a bit of a tear from when she calved. And there's no obvious discharge right here. And I also use the towel to see if there's anything obvious, but it's a lot of it's just manure. And so that's one thing to, when you're looking at your cows, to be observant on. If there's any abnormal discharge, that's going to be your deep red, your brown color, sometimes even black. And if you have a nice, I'd say almost yellowish, kind of thinking like sunshine color, but a nice yellowish color coming out, that's clean discharge, as I like to say. So that her uterus is cleaning itself out after calving. Other piece that you want to look at when you're examining the cow from the rear is getting a good look at her manure. And that is going to indicate a couple things of if she possibly has blood going through her digestive system, or if she's ruminating well, or any other digestive signs that you can get from the manure. And so you put on your full sleeve, and then you also put some lube in your hand. And what I like to do is let her know that I'm here, and then kind of go in with like a triangle mouth. And so that's just easier for entry. If she'll let me. All right. And so, especially with fresh cows, this area is quite tender just from the calving process. So be mindful of that. Don't be too forceful, and work with the cow. So when you're in the rectum, you can feel in there for any obvious signs. If you can feel if the manure is really sharp, possibly some corn's not getting broken down properly. But then you just get a scoop of manure, and then you pull it out, and then you can look to see and just kind of run your fingers through it. This manure I don't have any concerns with. It's not very loose or watery. It has good consistency and texture to it, and you can see some pieces of hay coming through there and the forage. And so overall, I think this is plenty good for a fresh cow. So when I am looking at this cow's backside after I've taken her rectal temperature, after I've checked for any obvious injuries or discharge on her vulva, I'm also looking at her udder and her legs. So this cow, she's recently been milked, so she doesn't have much udder fill going on right now. And if we look, she has good definition between the quarters. You can see that her left side quarter is a bit fuller than her right side, and that could just be a difference in udder tissue. If there is swelling, that could indicate she might have an infection called mastitis in there, and that would be something that we would need to investigate and possibly treat if it calls for it. I am also looking at her legs and her hooves to see if she is favoring one side or the other, or if there are any scrapes, any swelling, any concerns for injury there. And then also I am looking at from between her legs and her udder if there's a friction spot between those that has caused that skin to rub raw. We call that udder rot, or it's also called udder dermatitis. And so those are some things to keep an eye out for from the backside. I am currently on the left side of this cow. On this side, I am going to be listening to her rumen, and that's going to be checking for a DA, a displaced abomasum, but also listening to ruminating sounds, which should be about 2 to 3 rumen movements per minute. And then also going to be listening to her heart and her lungs. And I also look at general body condition on this side as well, just to see what her stomach fill, her rumen fill is like, but also her body condition over her hips and her pins. So right now I am going to listen to her rumen. And so with your stethoscope, just remember that this big flat side goes against the cow. So I just heard a rumen movement. It'll, at this spot, if you couldn't see, my hand actually moved out, and the rumen is essentially a giant ball of muscle. And I just heard another rumen movement. You can see that my hand's getting pushed out. And so just 2 movements within this period of time already gives me a good indication that she is ruminating, her rumen is working. And that's also a good sign if you're concerned about a potential DA, but you still always want to check for it. And so when I'm checking for a DA, I always like to check down here in this area and also up into the area that I had the stethoscope in. So this is where you would potentially be able to hear for a displaced abomasum. And what that sounds like, if you've ever heard the sound of one of those plastic balls that you've either had in gym class or even at Walmart or whatever, and it's like that ping sound, that's something that you'd want to listen for. If you are not confident in detecting for a DA, that is something you can always have your veterinarian teach you and also diagnose for you. So right now, I'm going to show you how I check for it. So also, if with it, this is quite a tight space between the cow this gate in the wall. And so I'm constantly just, the cow knows that I'm here, but also making sure if I need to get out, I always have a safe place to move. And so before I touch her with my stethoscope, I am always letting her know that I'm here. And I'm also using just good practices of personal safety. And so I'm very leery to stick my hand in between two bars, especially if I have to touch her, because she's constantly moving and I don't want my hand to be squished. So a lot of times I just go over the top. So if I'm listening, you use your finger to kind of flick her side, and don't worry about being too rough with it, because the big thing is you want to hear that pinging sound, which is going to be that gas buildup in the abomasum. And so what happened right there, where I had my hand kind of way up here and adjusting the stethoscope, is I couldn't hear my impacts with my finger through the stethoscope. And so that's where I readjusted to make sure I could hear what I was doing and possibly detecting the DA. So I didn't hear anything on her, which, with her having really solid rumination sounds, I wasn't too concerned with that. And now to listen to her heart. This is where it's going to be, with this setup, a little tricky, just for the human safety side. So what you're going to want to do is, with her front leg, you're going to have to sit right in here to listen to the heart. And we'll see if she'll let me do that. This is something where if you're not comfortable doing it, focus on your safety first, because you can always have a veterinarian come out and do this for you. And so that's just where I'm always watching what she's doing, whether if she might kick me or she might so right there, I'm hearing really solid heart sounds. Definitely take some time just to get yourself acclimated to the sound of a healthy cow heart, and so that you can detect possibly any abnormal sounds if you are concerned with that. Abnormal heart sounds could be from pericarditis, any infections that do affect the heart itself, or also the sac around the heart, and also any brisket diseases can really affect the heart. And now for the lungs. So for the lungs, lung sounds can be tricky to first detect and then get used to. It's really that whooshing sound of clear air movement. If you hear either what I say dead air, no movement, or just very short, broken up airflow, that'd be concern for some respiratory problems. But there would also potentially be other indication of respiratory issues like coughing, nasal discharge, stuff like that. All right, so from what I heard, she had really clear airflow. Um, so I think I took maybe 10 seconds of just one, finding the right spot, but two, just focusing on listening into that sound, and also with my eye watching her breathe as well to help me zone into the sound that I was looking for. And so she's pretty good on this side. So on the right side, I am also going to be looking over her general body condition, looking at overall rib fill, and then also from her hips to her pins, looking at the fill in this area, see if there's any signs of outward abscesses or injuries or any obvious signs of concern with her. I'm also looking at her legs and hooves again to see if one, she's favoring one leg or the other, but also for any swelling, any injuries. And then also looking at just her barrel right here to see if there are any concerns with her milk vein or any other potential injuries, issues that can come from that area. I'm also looking at her udder to see if there are any signs of that udder rot, but also any signs of swelling or injury. For this portion of the video, we're going to be going over examining an udder and learning how to see visual signs of mastitis, which is an infection within the udder itself. It can be caused by a few different types of organisms, and so you'll be able to access some resources later on with more information on that. So this cow right here, she has a blue band on, which on this farm stands for she has recently had a calf. And so you can see visually that she does have some swelling in her udder. That's actually from edema, so that's not an infectious related swelling. When I'm looking over this cow, I'm also seeing if there are any signs of potential injury or trauma to the teats and the teat ends, whether that be swelling, bruising, and also the overall health and cleanliness of her udder. And you can see just on the cleanliness of her legs and her udder that their environment is well maintained. For her, when I am looking for visual or tactile signs of a potential mastitis infection, I always look and feel the udder itself. And remember that cows run between 1013 to 102.5 degrees, and so they are quite warm already compared to what a normal human temperature is. So they're going to feel warm. But for mastitis, you're going to feel just like when someone has a fever or they're running hot, you're going to be able to tell right away, oh, wow, that's quite warm. So feeling that, also touching to see the hardness of her udder as well. So with the edema, that feels quite different than from an infection, swelling with that. And it's very much a trained skill, and with over time and experience, you understand those differences. So with this too, I'm also looking at her teats. I'm looking at the cleanliness. I'm looking at the teat ends. Once again, looking for any bruising, any signs of injury, and also looking for that udder cleft dermatitis that might happen right here in between her leg and her udder. I mentioned before that this cow has udder edema. How I can see that quite clearly is she has quite amount of fluid right along her barrel where, with the force of gravity, that fluid has dropped and collected here. And she also has quite a bit of swelling up in this front area. If I press and you see that there's a depression, that's a quick and easy way to tell that that cow has edema in that area. You can also see it here where she has quite a bit of swelling on this side as well. So if I were to do that same thing, and you can see that there is that depression right there from my thumb. I am examining the teats here, and I notice on this one teat that some warts are present, and I'm also looking at the teat ends to see if there are any signs of hyperkeratosis, which can increase a cow's likelihood of getting mastitis in the future. And I'm also looking for any signs of injury or bruising or trauma. This is a video panning from the front to the rear of the udder, so you can see how the swelling presents and what this cow's udder looks like. I also have another cow here who is not showing the same signs of edema as this first one. And so you can see that she has clear definition of some of her vascular system of her udder. And also her udder looks quite different, especially from the rear. You can see she has that clear medial cleft ligament depression right in between her two quarters. And also she doesn't have that swelling. Towards the front of the cow, this is where I'm going to be checking out her head and her neck and seeing if there are any abnormalities just in how she is presenting with her ears, her eyes, her nose, her breathing. So right now, this cow here, I'm first looking at her ears. They are pretty planar or straight across. And so that's a good indication that she's feeling all right. And also, I am looking at her eyes. They're not glossed over. They're not dull. They're not sunken in. They're nice and bright and shiny. And so that's also a good indication that she is not unwell. And then also another thing is when I look at her nose, if it's dry, that could be an indication that she's experiencing an immune challenge or possibly something respiratory. And just over her overall general behavior and attitude. She is not being very lively at the moment, but she is being quite expressive, so that we know that she doesn't really have a depressed mood as well. All right, so I have tied this cow's head back so that we can clearly access her neck vein here. And so when you are trying to find that, you'll want to pull their head back so that you can see this beautiful jugular groove right here. And I like using a headlamp just because it gives me clear access to light and a dedicated light so I can see what I'm doing and where I need it to be. So I get down to this point, and this is also why it's very important to have her head securely tied back so that she can't throw her head and potentially injure you. And see, that's exactly it. And so you see this nice jugular groove as it sits in here. And so it'll be this area. It'll be that area where you're going to be looking for her jugular vein. And so what I do is I put my hand down to this low point here. And then I push my hand back. And if you can see this nice bubble that's happening right in here, if I'm doing that, that means I've found that vein. And you'll also be able to feel the pressure build up against your fingers right here. And if I let that go, you see that go down, and then it just falls back to normal. To properly remove gloves, first you're going to pinch the middle of one glove, hook two fingers in there to help you pull that glove off of your hand, and then you're going to ball up that dirty glove in your other hand, and then you take two fingers and slide it under the glove that you still have on, hook those fingers and pull downward to pull off the second glove, and there you go. I would like to thank you all for watching this video on performing a general cattle health exam. If you have any questions afterward, please feel free to contact me. On the screen is my email, my work phone, and if you scan the QR code, you will also be able to access all of that information as well and be able to save it right into your phone. And once again, thank you so much, and it was a pleasure making this video, and I'm glad you could join me along for the ride.